That burning feeling when you pee? Ugh, it's the worst, right? Most of us immediately think, great, another UTI. We might even reach for some cranberry juice or an over-the-counter fix. But hold on a second. Have you ever wondered why your doctor might hesitate before just handing you a prescription for a urinary tract infection? It's because that burning sensation is a classic crossover symptom. It could be a UTI, but it could also be something else, like the sexually transmitted infection gonorrhea. Making the right call is crucial, and it all comes down to a careful diagnostic process. Let's walk through how a doctor thinks. When you come in complaining of painful urination, they have a checklist in their mind. First up, the UTI. They'll likely ask for a urine sample. This isn't just to see if it's cloudy. They're looking for specific things under a microscope: white blood cells, which signal an infection, and bacteria. A culture might be done to identify the exact type of bacteria and what antibiotic will be most effective. This is the standard procedure for a suspected UTI, and it's usually quite straightforward. But what if other symptoms are present? For men, a discharge from the penis is a huge red flag. For women, it might be an unusual vaginal discharge or bleeding between periods. And for both, pain in the pelvic or abdominal area can be a clue. These symptoms don't typically line up with a simple UTI. This is where a doctor's thought process pivots. They'll start considering STIs, and gonorrhea as a prime suspect. The testing for gonorrhea is different. While a urine sample can be used, it's being tested for the genetic material of the Neisseria gonorrhea bacteria, not just general signs of infection. Often, a swab test is more accurate. For men, this involves a swab of the urethra. For women, it's a swab from the cervix. These samples are sent to a lab for what's called a nucleic acid amplification test, or NAT, which is super sensitive and can detect even a small amount of the bacteria. So, why does this distinction matter so much? Because the treatments are completely different. UTIs are typically treated with one type of antibiotic, while gonorrhea requires a different, specific antibiotic regimen, often an injection followed by oral medication. If you misdiagnose and treat gonorrhea as a UTI, you're not just taking the wrong medicine. You're allowing the gonorrhea infection to persist and potentially cause serious long-term complications. For women, this can include pelvic inflammatory disease, which can lead to chronic pain and even infertility. For men, it can cause inflammation of the epididymis, affecting fertility. The infection can also spread to other parts of the body, like the joints or blood, which is very dangerous. This is exactly why self-diagnosing and self-medicating is such a bad idea. You might think you're handling a simple UTI with an old antibiotic you have lying around. The medicine might temporarily reduce the burning, tricking you into thinking you're cured. But if the underlying cause is gonorrhea, the infection is still there, silently progressing and potentially being spread to others. You're not solving the problem. You're just masking the symptoms while the real issue gets worse. So, the next time you experience that telltale burn, please don't jump to conclusions. It's a signal from your body that something is wrong, but you need a professional to figure out exactly what. See a doctor. Be honest about all your symptoms and your sexual history. It might feel a bit awkward, but that information is vital for an accurate diagnosis. Getting the right test leads to the right treatment, which is the only way to truly protect your health. If you're ever worried or need confidential advice, there are resources like local health clinics and hotlines available to help. Thanks for watching, and remember to take care of yourselves. Don't forget to like and subscribe for more health insights.